H2O for all, giving life through water. The Kawolo Hospital project in Uganda is an example of how H2O for all operates in order to achieve positive changes. The Kawolo Hospital is a trauma center strategically located east of Kampala. It serves 4 districts as well as the surrounding areas. It cares for more than 400 patients every day, and it provides services to close to 100,000 outpatients annually, including expectant mothers. However, its resources and infrastructure are far from adequate. In fact, the hospital is behind many of the general guidelines for safe medical treatments. Sadly, 16 women die every day in Uganda from preventable pregnancy or complications during childbirth. Many of these cases are a result of waterborne illnesses. Learning about these limitations, H2O for All implemented Phase 1 of a 3-phase project during the summer of 2012. With the support of a group of Canadian volunteers and community members, H2O for All successfully installed a solar-powered water and filtration system beside the maternity ward of the hospital. Today, this system is providing clean water for all maternity needs, including cleaning and washing. In February of 2013, H2O for All went back to Kawolo Hospital. We learned about the positive impact the water system is having in the hospital and within the community. For example, morale has increased among employees, patients, and people in the community. There is a decrease in infections thanks to new window screens and new beds. The number of babies born at the hospital increased, which led to the ward operating at its full capacity. There is a decrease in maternity sepsis from 8.6% to 2.8% during the first 3 months, and within another 3 months that number fell to 0. And by using clean water, there has been an improvement in sanitation and hygiene practices in the maternity ward. But there is much more needed at the Kawolo Hospital. Dr. Simon knows firsthand.
The truth is the water challenge is all over the hospital. And like I said, our prevention of infection, rule number 1 is wash hands before and after every patient. So you have 200 patients and you don't have water. So it is a big deal. The community being the health workers and our patients, we can prevent infection most importantly. 2, we can reduce on their financial constraints because they cannot afford this. So there is a burden, a financial burden that will be lifted if we have this project running and we have enough water. And then we shall be able to provide our services timely and then to everyone, and most importantly at a reduced or a free cost. Yeah, so for us it's a big deal.
H2O for All is working to implement Phase 2 of this project. This phase will provide much-needed clean water to the operating room. To do this, we will dig a borehole, install a solar-powered pump, and H2O for All's filtration system. As a result, the operating room will have access to purified water, literally giving life to thousands of patients. We can all give life through water. Investing in long-term, sustainable development is crucial to alleviate poverty and diseases. Your financial support will provide the necessary infrastructure to allow the Kawolo Hospital and surrounding communities to access safe and efficient surgical care. With clean water in the operating theater, the risk of infection will be eliminated for thousands of patients. This will save lives in the communities. Your support is an important way of how we can give life through water. H2O for All, giving life through water.